shared care record really is a collection of data about a patient where somebody might be interacting with different care services across Hampshire and Isle of Wight. What a shared care record does is brings that data together into a single space across those care settings. Last year we went live with the Orion Health solution, and in Hampshire and Isle of Wight we call that the Care and Health Information Exchange, or CHIE, and we're now deploying that to our care homes. The benefits are fairly profound.
Before CHIE, my staff used to spend a lot of time on the phone to hospitals, GP surgeries, multidisciplinary teams. So it's just as fast as a click and we can get that information.
The data is most usefully around medications, allergy information, particularly for new admissions where they might not have the history of that resident.
It's been brilliant because I can click on it and when residents come in and they've come from home, they don't obviously have a discharge summary. Somebody might have diabetes that they haven't necessarily told us when they've moved in, so then we can link it to their digital restore news score and we can access everything we need from there.
Data security, very important with the NHS, and very important to make sure that patient records are only accessed by the right people. So we've implemented multi-factor authentication, which is where the user enters their username and password, and they also need to enter a one-time passcode which is sent to their device. Very much like the same way that you use in other banking and secure apps.
By definition, people who are moving into a care home are vulnerable in one way or another. They might be frail, or they might have not much memory, or they might have difficulties communicating. So a few weeks ago, Mum had a blood test, and a few days after that, I phoned the surgery and I was on hold for 15 minutes. But now they've got the CHIE system, they can also see immediately what the results are. So I think that's a huge benefit, is having immediate access to things.
I feel much more confident using CHIE. I've got access to residents' medical history. It means that I can deliver the correct care. It means that I know everything about everybody that comes into the building, and it means nothing's missed.
Well, my family, they all live in Kent, and I know here they inform them on different things that's happening, and I'll be more relaxed because I know that I can go to management team and they will be able to help me.
I've recently become a manager. For me, it's a godsend because residents come in and I have to do all their care plans, and I'm also medication lead, so it just makes it so much easier for me.
In the new digital social care programme, our new ethos is more time to care. So by providing care homes access to CHIE, they become part of that growing data sharing world that we now are in the NHS.
I would say definitely get to know CHIE, understand it, have a play around with it, learn about it, get it into your care home as quick as you can. It stops the waiting times and it ensures that our residents get the best care they can.